Hello, we are your inpatient therapy team for the joint replacement. With the opportunity now of not having the coaches here in the gym with us, we are going to show you some instructional videos that you can watch at home and your family can observe so that they kind of get the idea of what they need to do to help you at home. My name is Clara. I'm a physical therapist. I will be seeing you generally for the initial eval. This is Tara. She is an occupational therapist. She will also be doing some evaluation and helping you with your personal care and how to adapt that after your joint replacement. This is Lisa. She is the physical therapy assistant that will be working with you after your evaluation to prepare you to return home. The first instruction that we're going to do is Tara is going to show you some adaptive equipment to make it easier for you to dress your lower body.
I'm going to be showing you how to put your sock on using our adaptive equipment after you've had your surgery. So this is a sock aid. It's a hard piece of tubing that you're going to slide you're going to slide your sock over it to help you put on your sock without putting a lot of strain on your knee or on your hip, whatever you've had replaced. So how you do this is you take your sock and you will put it over the tube. Take it up to the knots here, and then I want you to go ahead and pull your sock up until it gets all the way flush at the end. When you do this, I want you to make sure that the top of your sock is on the top and the bottom is on the bottom, because whichever way you put it on the sock aid is how it's going to go on your foot. So it's got two handles here, and you will put it down on the floor. You will put your foot inside of the tube, and then you will pull on these handles. And as you do that, it's going to slide your sock onto your foot. You might have to use another piece of equipment to help adjust it a little bit if you can't get down to your sock all the way. So we have a reacher that can do that. You may have seen these around. You can get them generally at medical supply stores, or also pharmacies have these. They've got a little pincher here that you can pinch, and you can grab a hold of your sock and pull it a little bit if you need to. If you need to pull it up, if you need to adjust the bottom, you can pinch the side, pull it up that way, just like that. It's also got a little hook on the side that whenever you're ready to take your sock off, you can use it to do it. You can use it to pull it down that way if you want to. If not, you can put it on the side with the little grabber, and then I want you to pinch it, and then you can take your sock off with it that way. It also works for if you have dropped your sock and you need to pick it up. You can obviously pick it up this way, and then you can put it on your sock aid at that time. Another way that you can use the reacher is to help kind of get your pants started. So with having a new joint or a new knee, sometimes it's harder to bend over. So you can take the reacher and you can grab the top of your pants and you can lower those to the ground. You can get your foot started on your surgical side and help pull them up until you can comfortably reach down with your other leg or with your other hand and pull your pants up. And then your other side should be fine to put your leg in the correct way. The reacher can also be used to take your pants off. So if you've got your pants up here where they normally are, you can take them down as far as you can, and then you can use the reacher to grab a hold of them and to pull the pants off the rest of the way. And then after you get them off, you can use your reacher to pick them back up and put them wherever you need to. The reacher can also be used to grab your shoe and put it in the appropriate place. Usually I recommend for patients to grab the tongue of the shoe and to hold it open so that then you can get your foot in the correct way and then slide your foot in. So those were just two of the main pieces of equipment that we usually recommend to patients who have had a joint replacement. There are other pieces of equipment that may be helpful to you, and we will go over those whenever you come in here for your joint replacement, and we'll see if those pieces of equipment are appropriate for you. The adaptive equipment is nothing that you need to purchase before your surgery. We'll take time to go over that whenever you come in, and we'll see what works best for you.
Next, we are going to show you how to get up and down from the chair. Use your walker and going up and down the steps. You see this piece of tape here on Lisa's legs? That's to indicate this is the leg that she had surgery on, to help you kind of get a visual cue for that. All right, so first, when we're getting up from a chair, we want to scoot to the edge of the chair, putting your hands here and kind of lifting your bottom and scooting out. You're going to want to keep this leg out in front of you just a little bit to protect that. Anytime we're getting up and down from a chair, we always want your hands to be on the chair so you can push yourself up and you can lower yourself down. This black belt you see here, this is a gait belt. It's something we use so that we can hang on to you and help you if you happen to lose your balance. So I will be grasping that in the back. You'll put your surgical leg out, you'll push up from the chair, and then you'll grab your walker. You always want to stand here for a moment, make sure you're not dizzy before you step away from the chair. The correct height of the walker is generally when you put your hand down, it should come at the bend of your wrist. So you have a slight bend in your elbow, but you're able to push through that arm. If you're standing and you're feeling okay, then we can walk away. You want to take your walker forward, step with your surgical leg first, kind of push through your arms as you step on through. Okay? And you'll just keep repeating that. Lead with your surgical leg and then your other leg. We're going to come up here to the stairs. And we're just going to go through the basic way you would go up and down the stairs. We know every person's home is a little bit different, and we will go through your exact setup of the stairs when you're here, but we just want to show you a quick general process of how we go up and down the stairs. Okay? As you come to the stairs, you're going to want to be able to hold on to something, so rails are very good. If you don't have rails, then you want a person that can help you too. You want to take this walker and you want to get it out of the way, so take it to the top of your stairs. And we'll come up close to the step. We're going to go up with our good leg, so that will be this leg up. Then you're going to push through your arms and bring that other leg to the exact same step. We don't want to step over step, we want to go to the same step. So up with your good leg, push, step up. Once you are at the top of your stairs, you'll want to grasp your walker and then go into your home. Okay? Now then, to go down the stairs is going to be the same type of thing. You will grasp the rails. You'll want to put that walker at the bottom of the stairs. And this time we're going to go down with our surgical leg. So going to put that down, lower down, put both feet on the same step, and we will go down the steps. At that bottom step, you'll grab the walker. Again, surgical leg first and then the other. Next, we're going to go over how to get in and out of a car for when you're going to home. You're going to use your walker and come up to the car and have them open the door. And then we're going to walk up to the seat just like we were going to sit on it. We want to stay close. All right, now, when we're ready to sit down, we're going to want to put our surgical leg out a little bit, and then we're going to want to sit down into the seat. If you want to use the door as a support, you need your window down and someone needs to be holding on to it because we don't want that door to pull in on to you as you're sitting down. So you'll move your walker out of the way and watch your head so you don't bump it and sit down easy there. Now then, the easiest way is to scoot as far back on that seat as you can. And before you would get in, you would want to make sure that you took your car seat, you put it back as far as it could go, and if it would recline back, you would want to recline that back to give you as much room in the front for your leg to get in. Then you're going to bring that leg in. You may need a little help to get your surgical leg in, and then buckle up and you're ready to go. The way to come out is the same. You're going to want to scoot over as far as you can to the driver's side. You may need assistance bringing that leg out. And then again, you scoot out to the edge. You always want to take a moment because if you've been riding in the car for a while before you get home, that leg might be just a little bit stiff. So kind of sit on the edge, move that leg just a little bit back and forth so you know it's going to hold you up. Again, you bring that walker there and you're going to push up. Grab your walker. If you're feeling good, then you can walk away from the door and you're ready to go into your home. We will be available for questions or any kind of instruction you'll need. We'll be going through that with you prior to your discharge. We just want to give you a little bit of opportunity to view this before so that you can practice a little bit at home before you come into your surgery. We're looking forward to seeing you.